Today's HealthCast, the focus is on feet. I think that might be a first. Christy is back now with the details on some common conditions here.
This one is actually called Morton's toe, and if you are physically active, this one can increase the risk of you having a stress fracture. Now, people with this condition have an abnormally long second toe, it's true, which can throw off your whole natural gait, putting greater pressure on the ball of your foot.
Normally when you walk, the outside of the heel hits the ground, your foot comes into pronate, which everyone does, and pushes off the big toe. When the second toe is longer, it takes more pressure, and that leads to other problems.
Now, along with stress fractures, Morton's toe can also cause problems like instability, calluses, and all kinds of problems with your Achilles tendon. Yikes. And the best way to treat it is to fit your shoes with special insoles. Morton's toe should not be confused, though, with something called Morton's Neuroma, another painful foot problem. And Local 10 medical specialist Dr. Soffer has more on that.
Ellen Mayer loves playing tennis, but there was a time when chronic foot pain kept her out of the game.
It was like walking on an annoying, painful pebble on the bottom of your foot. On a scale of 1 to 10, definitely a 10.
The cause? A condition called Morton's Neuroma.
Morton's Neuroma is a very common problem. It's been diagnosed in probably more women than men. It's usually a result of narrow shoes.
It involves two nerves that cross the bottom of the foot, joining up near the joints of the third and fourth toes. Narrow shoes can cause the nerve to get pinched and swollen.
Once it's swollen, then typically a shoe that may not have even been a problem to begin with becomes a problem, and you start to develop scar tissue around the nerve, and that's called a neuroma.
Ellen actually underwent surgery to remove the nerve, but it grew back. She turned to Dr. Weinstein for a new treatment option: injection of a sclerosing agent that desensitizes the nerve.
And some people may still require surgery, but it's certainly a great option when I have many patients that would rather avoid it if possible.
The injections got Ellen back on her feet. If caught early, no treatment may be necessary. At the first signs of trouble, such as numbness or tingling in the toes and cramping in the ball of the foot, it's time to move yourself into a wider shoe. With your second opinion, I'm Dr. Soffer.
And when it comes to buying those shoes, always try them on, get this, at the end of the day if you can, not when the stores first open. That will help account for any kind of foot swelling. Victor?